Thank you for joining us today. My name is John Dubas, and we'll be spending the next 20 minutes or so discussing one of the programs the government has in place to help Medicare beneficiaries who qualify for this program deal with the cost of both medication plans, medication cost, and medical costs associated with the Medicare program based on income and assets. We'll go through this in some detail and spend a little bit of time with you concerning these programs and how they may enhance your current situation. As I mentioned, my name is John Dubas. I'm a licensed insurance agent affiliated with Premier Marketing. And so today we'll be going through and explaining what MSPs are, Medicare Savings Programs, how these programs work, how they work in relation to other benefits that you may have in play, how to help you engage these programs for yourself and others who are dear to you, and speak to some additional resources that may be helpful for you as well. Medicare Savings Programs themselves, MSPs, are Medicaid administered programs that help cover Medicare premiums and cost sharing for those who have Medicare with limited income and resources and don't qualify for full Medicaid. These programs are known by different names in some states. So it's kind of lipstick on a pig, so to speak, where in your state, these MSPs might be called Medicare buy-in programs, Medicaid buy-in programs, Medicare assistance programs, or may go just by their acronyms, Medicare Savings Programs, and the type of Medicare Savings Program that is applicable to your situation. These programs buy those who are eligible into Medicare itself as well. Why are they important? Well, Medicare is the primary health insurance for many folks age 65 plus and younger adults who are receiving Social Security disability income benefits. But Medicare itself is not free, and the out-of-pocket costs add up and increase each year, and they include premiums, deductibles, co-payments, insurances, and some folks just can't afford some of that because we'll find that half the people with Medicare have income below $29,650, at least according to Kaiser Family Foundation numbers from 2019. These programs can make Medicare so much more affordable for those who qualify. There are 4 types of coverages, 3 that are most common. The first of which is a qualified Medicare beneficiary, a QMB, a QIMB, you'll hear it said. And these will pay Part A premiums, if applicable, Part B premiums, and also pay Part A and B deductibles, co-payments, and or co-insurance, depending upon your circumstance. Other programs that follow that, well, specified low-income beneficiary individuals, SLIMBs, SLMB individuals, these programs pay only the Part B premium. But for those who qualify for this assistance, that's a healthy raise in the income. There are, of course, also qualified individuals, QI individuals, and this also only pays the Part B premium. In the past, it was funded through a block grant, but was made a permanent part of Medicaid under MACRA, the Medicare Access and CHIP Reauthorization Act of 2015. So you have 3 different programs that come into play quite frequently for a number of individuals, and a number of folks who qualify for these programs don't have this coverage, even though they qualify. The 4th area is the QDWI. These are folks that it's a lot different than the other 3 MSPs. These are qualified disabled working individuals, and it's for people under the age of 65 who perhaps lost their premium-free Part A because they've gone back to work after getting SSDI long enough to have received Medicare. The QDWIs also pay Part A premiums for those who qualify, at least in 2021, and the income and assets tests are completely different than the first 3, and the income is up to $4,378 a month with a $20 disregard if a person is an individual, almost $6,000, it's $5,892 per month if the individual is married. The assets test for this is different than the other 3 as well, where the assets are up to $4,000 if a person's single or $6,000 if they are married. The benefits for these programs, well, it does away with that Part B late enrollment penalty. So that coverage, that voluntary coverage that some people may have declined that handles the medical portion of it. If a person didn't enroll when they're first eligible for that or in the grace period for it, it's a 10% penalty per month, or pardon me, 10% penalty per year on that premium amount. And that is taken care of by an MSP. It's really helpful also because it doesn't involve any estate recovery, which many people may run into if they go into an assistance program for long-term care. So states are not allowed to ask for repayment of the cost if they're covered under an MSP from the estates of deceased MSP recipients. That makes it so much easier for the folks that deal with the circumstances once a beneficiary has passed. And those that are eligible for MSPs automatically get the Part D low income subsidy, that extra help. They are deemed eligible for this assistance, and this is the program that helps with the cost of prescription drug programs for Medicare. So the cost of the prescriptions themselves and the cost of the prescription plan, if applicable. How do these programs work? Well, CMS in the different states, the Center for Medicare and Medicaid Services, and the state Medicaid agencies work together to provide this help. CMS and the federal government oversees the program. They provide the matching funds with the states for the QIMBYs and the SLIMBYs. Remember, we're using acronyms from the past here. And they provide 100% of the cost for the QI block grant individuals. The state Medicaid agencies administer the MSPs, so they determine eligibility. They pay that Part B premium on behalf of the first three MSP plans, the QIMBYs, SLIMBYs, and QIs. They pay the Medicare co-payments, co-insurance, and deductibles to healthcare providers on behalf of the QIMBYs, because remember, SLIMBYs and QI1s, it covers the Part B premium, but not any of the medical costs. And it also pays the Part A premium for those who owe it on behalf of the QIMBYs and QDWIs. Who's eligible for these programs? Well, these are individuals that have Medicare Part A. They've got to meet different income and resource eligibility tests. We'll go through those in a moment. And the financial eligibility guidelines are set by law, but states can raise or eliminate these tests. And we find that 9 states have eliminated the assets test. So Alabama, Arizona, Connecticut, Delaware, Mississippi, New Mexico, New York, Oregon, Vermont, and DC have eliminated those resource tests. That's important to note because if you live in one of those states and move to a state that does have the resource test, you may not qualify in your new home. Generally, these applications are submitted through the local Medicaid agencies. These are a lot of times domiciled in the Social Security offices, and folks can actually start the application for MSP by completing the LIS application. Gee, John, you threw a lot of acronyms at us. If someone's looking for help on their medication costs through the low income subsidy extra help program, well, that starts in a process, that application process for a Medicare Savings Program as well. Eligibilities for these programs are generally redetermined each year. We see these come into play, these new limits, in March or April of each year. The eligibility rules, well, you'll see that in each of these qualifying factors here, we've got different income that limits that are applying. The resource test, as you see, is the same for all 3 programs. They are different in the continental United States from Alaska and Hawaii. The numbers for the income is slightly higher in those 2 states. You'll see that the QIMBYs, the qualified Medicare beneficiaries, these are folks at 100% of federal poverty level. SLIMBYs are at 120%. QI individuals go up to 135. That is 135% may help you realize that's a correlation to a fully subsidized LIS individual as well. You get help with your drugs and make a little bit more money than that. But for these assistance programs, you've got some shot at help for at least your Part B premium up to 135% of federal poverty level. The folks that are enrolled in the Medicare Savings Plans automatically qualify for that help with their medications through the Extra Help, LIS, Low Income Subsidy Program. And these programs mean you don't have to apply for it. So it's facilitated into those programs by CMS. It's important for us to note, though, that this is done with a grace period so you can tie in the plan that may best suits your needs. Because remember, if you don't, it's going to be a circumstance where the drug program is going to be just on a random rotating basis, takes into account the cost, doesn't take into account the coverages. So we want to make certain that we look at not just the dollars, but how those dollars can be stretched, or more appropriately said, applied to programs that can help us the most. When we look at those folks that qualify for LIS but don't qualify for MSP, well, they're going to get that help with their medications. It's going to, if someone does that application process, it does trigger the application for the Medicare Savings Programs. The state Medicaid agencies have about 45 days thereafter then to determine the MSP eligibility. And in these circumstances, applicants may be asked for further information and documentation. LIS program, they don't ask you for other details or other documentation. They're going through federal records. So some things to keep in mind there. How does these programs, well, what's the relationship with Medigap, Medicare supplement programs? Those people who have a Medicare savings program, do they need a Medigap policy, a Medicare supplement policy? Keep in mind, Quimby's pay all the out-of-pocket Medicare costs for E and B cost sharing, and these individuals, they should not be sold a Medigap policy. They shouldn't have purchased a Medicare supplement plan. If a person qualifies for MSP once they've already got a med sup in place, well, they can suspend that Medigap for up to 2 years when they're on a QMB, and go back into it should their circumstances change without underwriting. A big thing come into play there. But those two other MSP programs that we talked about that are generally an option for folks who are on Medicare based on age, 65 plus, well, Slimbies and QI1s, they only pay the Part B premium. You still have exposure with that assistance for cost. So advisors may help you assess whether or not a Medigap policy is your best route to take to cover those costs. We want to limit our financial exposure. MSP and Medicaid surplus income, or those Medicaid spend down programs, these are different things to think about when we assess how to use Medicare cost sharing amounts. So if we look to apply that surplus income spend down to get full Medicaid, or if we're looking to get an MSP and have Medicaid pay for certain other costs. It's important for us to note that how this is handled in the community versus those that were institutionalized, that didn't sound quite right. For folks that are in a long-term care facility, these folks, it's a different animal as to how it works. So at home, these are like any other community-based MSPs. If it's in a residential facility, this QMB will pay the skilled nursing facility daily copays that you'll see on traditional Medicare. That's a part of that coverage from days 20 to 100. So we want to look at long-term care programs as well in this circumstance. For the application process, for those who are eligible but not enrolled, well, if you have Part A but not Part B, the state Medicaid agency must enroll an individual in Part B during the QMB process. Keep in mind, if you didn't have that in play and you're subject to that penalty, well, QMB is going to take care of that. If the person doesn't have Medicare Part A, they need to go to the Social Security office for conditional enrollment. And in some states, they can only do this during January through March during the general enrollment period. So you got to check with your state authorities to see when the timing comes into play. And you'd need to take proof of that Medicaid assistance and qualify for QMB. So you've got a link here that can help you with that detail. The options on how to apply, whether it's a short-term versus a long-term program, depends a lot on the state and your circumstances, and this can be done simultaneously with LIS or triggered through low-income subsidy. You have different language access and MSP applications as well. The instructions come in multiple languages, the applications generally in English and Spanish. If you have billing issues when you have qualified Medicare beneficiary status, well, the provider's not allowed to balance bill, to charge the difference between what their rates are and what the coverage costs are how they're being covered. So piggybacking claims, those claims can be transferred automatically from Medicare to the state for Medicaid claims processing, makes it simpler for the beneficiary. And the rate that the providers receive for treating QMBs, well, most states reimburse at the lower Medicaid rate for QMB cost sharing balances. And that's why you'll see some providers accept Medicare beneficiaries or Medicaid beneficiaries and some who do not. How do you know if the recipient, you as the recipient or the providers, how do they know if there's an individual who is a qualified Medicare beneficiary? You do have an ID card. And once again, facts on this, the frequently asked questions are available through this link as well. There are things advisors can do to help you. They are generally familiar with the rules for MSP eligibility in your particular state. If there's a dual demonstration product, how that might affect different things. And this way, clients, you as a beneficiary, well, you can be helped prepared as to making certain that you know what information your state may ask of you to make a decision as to whether or not you qualify. And they may work with you as well to make certain that the applications are completed properly and processed in a timely manner. So this is a situation that as you as a beneficiary, if you provide consent, they can work on your behalf. Some do, some don't. It depends on your circumstance. And so they may also help you with other benefits that you may qualify for as well. Energy assistance, SNAP, used to be called food stamps. Different things that can come into play that can enhance your situation based on your own personal circumstances and whether or not, quite frankly, if you qualify. You have other ways of making certain that everything that you are being told and how it's being handled is on the up and up. These are all governmental agencies except for the National Council on Aging. That's an agency without above reproach. It does a lot of information dissemination for Medicare beneficiaries and help on their behalf as well through the benefits checkup program. So what we have here is a program that can help you stretch your dollars, get you additional assistance for costs associated with your care, be it through medications or through medical costs. Not only the costs of the programs put on or the costs that are associated, not covered by Medicare, but the programs that come into play and any applicable premiums they may have. All that said and done, we're here as a resource to help you and look forward to speaking with you if appropriate. Thanks so very much. We'll talk to you soon.